We,
Sohnia
and Jaanuni, are a couple of pals studying science in undergrad. We are not professionals.
Though every episode is meticulously researched, mistakes do happen.
If you notice that anything,
And we mean anything.
we state is inaccurate, please let us know.
Your comments, suggestions, and queries are important in furthering our personal and audience's understanding of science.
Thanks for being a part of this discussion.
We appreciate you.
We really do.
Bop, bop, beep, bop, bop.
Hi.
Hello.
Hello.
Okay. Welcome back to another episode of Beaker Bros.
Where we drink in beakers.
Because we're bros.
Great.
It's good.
Sohnia, what do you have?
Thanks for asking, Julie. Today I have, as usual, my iced espresso.
Ooh.
We put a little bit of a homemade vanilla syrup in it.
Okay.
Not to get too pretentious or wild or anything, but that's my drink. What's yours, Jaanuni?
Water.
Very nice.
Been parched lately.
Parched. Anyways, today's episode's an interesting one. I'm very excited for it. It's been something I've been wanting to chat about in this sort of civil, safe environment. And that is the COVID-19 vaccine. I'm going to be going over about a little bit of the history of vaccines in general, how they came to be. There's some fascinating discoveries and history behind it and stories behind it.
And I'm going to share my experience because I actually got the COVID vaccine. Well, the first dose at this time.
At this time, what day is it today? The 22nd?
22nd.
22nd.
I shall be
January.
getting the second one next week.
Oh, that's exciting.
Yeah.
Yeah, going back to the date, just to preface this, everything that we're saying, like from the science behind the vaccine, is relevant to today's date. If anything changes, either we won't post this episode, or rather, if anything seems like overly inaccurate, we won't post this episode, or we'll just make a disclaimer.
Yeah. Okay, vaccines have been, like, what is that word? Like, they've been used, like, we get vaccinated as a baby, right? But there is issues with, like, the current COVID vaccine. A lot of, like, talk, I would say, just going on.
More so controversy. Be careful with our wording here.
Yeah.
But yeah.
There's more controversy about the COVID-19 vaccine. But before we even talk about COVID-19, like, we should be aware that vaccines have been around.
Yeah. Vaccines, just to get into the history about it a little bit, have been around for, at this point, around 300 years or so.
Oh, wow.
Yeah, so, well, actually, in a way, even longer than that. So, literally dating back thousands of years, Buddhist monks, so they had their own, I guess, variation behind the idea of what a vaccine is. So it would basically like drink snake venom to counteract or like confer immunity to snake bites or like various like viruses. And that's kind of how vaccines in a way work right now.
Because when you're taking it in, it's not necessarily like the actual like, toxin you're taking in, but like in a way your immune system is like getting like it's training.
It's preparing.
Yeah.
It's bulking up.
It's like in the gym working out.
Yeah.
Like it's getting ready for when the actual
doing leg day, getting ready for that marathon.
Like never misses leg day.
No. But yeah, that's how like originally vaccines in their like simplest idea came to be. But it wasn't until around, I would say, what day was it? Or what year was it? It was the late 1700s, where this dude, Edward Jenner,
Kendall Jenner's dad.
Yeah, Kendall Jenner's great no. The dude named Edward Jenner. This guy's considered the founder of vaccinology. I think that's the term for it, where like the study of vaccines.
Okay.
During that time of the late 1700s, there was a huge issue with smallpox. That was sort of the pandemic of the day, if you will. It was running rampant. A lot of people were sick. A lot of people were dying from it. And at that point of medicine, there wasn't really anything to prepare the immune system to fight against smallpox. So that's what Edward Jenner set out to do.
Okay.
And in his sort of attempt to create some sort of antidote, he basically took this 13-year-old boy.
Don't look how this is going with it.
Let me explain.
Okay.
And he inoculated this 13-year-old boy with a variant of the smallpox virus, which was the cowpox.
Okay.
And wanted to demonstrate like how like immunity of the cowpox would lead to or like demonstrate immunity to, or like develop immunity to smallpox. So he inoculated this boy with that virus, exposed him to it in a way, and wanted to see like if that boy, like if he was later exposed to the smallpox virus that was currently ravaging everywhere, if he would survive from it. So that's what he did. He did that shortly after. Keep in mind, at this point in time, there was no like ethics boards that would mandate all of this. I guess like if we did that now, this would be very bad. But yeah, because there wasn't really consent granted to it. And so later on, once he gave this boy like the first this young boy like the first iteration of the smallpox vaccine, he later exposed the boy to the smallpox virus to
Does the boy have like any say in this?
That's like, again, it goes back to that whole ethics thing.
Yeah.
But anyways, the boy didn't get sick. He was exposed to the virus after being given like that first iteration of the smallpox vaccine.
Yeah.
And he survived.
Oh.
And because he survived that vaccine that what's his name, Edward Jenner created, was later given to larger populations, and it saved millions upon millions of lives. And then over the course of like throughout the 18th and 19th century, there was a systematic implementation of mass smallpox immunization programs, and it later led to ultimately eradicating the disease or the virus by 1979.
Wow. Vaccine, not necessarily like they were not injecting needles into people's arms back then. But it's different forms.
Yeah, different forms, different variations of how the quote-unquote vaccine of those days were delivered. But yeah, it just goes back to the same idea where you're exposing a population to something that prevents, or rather like prepares their immune system to fight off the disease. Yeah. And then when it works, it saves millions of lives.
It does. Because it's also like the idea of like, people are like, okay, so vaccines essentially, they are teaching the immune system to how to like react to the disease, right? Some individuals might be like, okay, so if I'm exposed to the disease, I must be immune.
Yeah.
Right? It's not the same, it's not as safe as it would be with the vaccine, right? And the vaccine, it's more, like, at least in like current times, it's more controlled, and like the response, we know what to expect.
Just to add on to this conversation about the history, during the 20th century, stemming because of like a lot of political mistrust that was going on in the world, and people just not trusting the people that were in power, not trusting governments, not trusting politicians. That's where the idea of like vaccine hesitancy really started. It wasn't just the idea of like people having their own biases towards whatever science meant. It was people having their own biases towards the people that were presenting the science.
Oh, okay. No, that makes sense. I can see how it relates to even like today, right?
That's why, exactly. That's why when, for example, the HPV vaccine first started being massively available in the or what was it, like 2007, 2008, when they started being like widely available, especially in developing nations, people didn't want to take them because they had the option not to and didn't trust the governments that were making them massively available in their country. Does that sort of make sense?
No, like I get it. Especially if we were to relate it to like the COVID vaccine, like now, like a lot of questions. Like I've had conversations with people, right? Just being like, when I had gotten the vaccine too, right? Like, oh my god, like how are you? How are you feeling? And there's just people I don't even really talk to, like messaged me about it, right? Because they're very curious about it. Is it safe? The whole idea is that there was actually like a lot of misinformation present. Right? In the news, there's a lot of side effects, and like I remember my dad telling me once, he's like, yeah, the 50 people in UK who got it, the vaccine, have died. I'm like, what? And I'm like, where are you getting this information, right? Again, like he reads Daily Mail, right? So I guess you can like already know the science behind that, you know. But people I thought who had the same resources as me to get this information would be just as informed as like I was, right? Because I could do a simple Google basically and
do a Google
search, and you can find literally if you put COVID vaccine, the first websites that are appearing are going to be from the CDC, Government of Canada,
Health of Canada, NIH, the National Institute of Health, the list goes on.
It's not just the first thing that's not appearing is Daily Mail. It's reputable sources, at least from my gathering of information that are informing of what the effects are, what is the vaccine or whatever, right? So with the COVID vaccine, it's an mRNA vaccine. So there's this whole idea, some people thought the mRNA vaccine would disrupt your DNA. So the mRNA vaccine cannot change your DNA, right? It's part of our genetic material that gives instructions to the body. It's essentially like a recipe you could think of.
Yeah.
It simply delivers a message. It is not going to go in, change your sequence. No, it is just...
mRNA. The M literally stands for messenger.
Messenger RNA, yeah, literally. Yeah. mRNA vaccine for COVID, it tells your body to make these harmless spike proteins, and I'll go more into what a spike protein is. Yeah. And these spike proteins are found on the outside of the COVID-19 virus, right? So it's not the actual virus; it's the outside of it, but it's not the actual COVID-19. And what essentially happens is that our immune system recognizes the spike protein as something that shouldn't be there, and it essentially quickly works to attack it by building antibodies and the immune cells that would attack the actual COVID, and so it prepares you for if you're exposed to it in the future. And then your human cells will break down the mRNA and get rid of it. So don't worry, it's not disrupting your DNA. And after they're finished using the instructions, the mRNA will not interact with any other cells, part of our cells that holds the DNA and cannot.
So when people say that they're worried that mRNA might disrupt your mRNA might disrupt your DNA, people, when they think, oh my god, my DNA is being destroyed,
I'm gonna appear with purple hair tomorrow.
I'm gonna have some sort of mutation.
Yeah,
that's not what's happening.
No,
that's not what the mRNA does to genetic code.
No, it is simply telling. Here you go, here's the recipe, make the meal. Yeah. And it's just I'm gonna go. Yeah. It's Gordon Ramsay coming into the house. This is how you cook, Jaanuni. I'm okay,
he makes you a dinner, you're fed for the day, you're prepared, maybe you'll have those leftovers keep lasting you, right? That's the preparation for your immune system, right?
Leftovers.
It's the leftovers that keep you fed and safe.
And then, but Gordon Ramsay, he's gone.
He's dipped.
He made the meals for your week.
He's laid that foundation.
Yeah. He left the recipe too, in case you want to, he left the ingredients.
Yeah.
The ingredients.
Oh, that's a good one, yeah.
He left the ingredients. He's you need the tomato to make the tomato sauce.
Instructions to the grocery store.
Oh, how to get to Portino's.
Think of your vaccine, the COVID vaccine, like Gordon Ramsay.
Gordon Ramsay's actually the mRNA.
Oh, excuse me. Right,
yes,
right,
yes. Yeah. He's
leaving the instructions.
Yeah. Yes. But let's go back to the actual science, not in case Gordon has confused you. The spike proteins, I mentioned the spike proteins, right? So these cover the outside of the virus. Yeah. Outside. And it'll be, with the presence of the spike proteins that are part of the COVID-19 virus, it essentially allows it to attach and enter our cells. But what the vaccine does is basically prevents all of that. Your immune system responds to the spike proteins by making antibodies. So antibodies are kind of they bind to the spike proteins, right? I'm trying to make sure. And they block the spike proteins from binding onto the virus surface. It's like a bouncer, one might say.
Perfect, yeah.
A bouncer. So it's it's carding you. You know what? Can tell it's a fake ID. Yeah. It's no, go back.
Not allowed.
Not allowed. So it's not letting you come in. And it's important definitely for the protection from the disease, because if the spike protein was to attach to the cells and allows the virus to actually enter, then that's when COVID happens, basically.
When you get sick, yeah.
So blocking the entry is definitely very important for preventing infection. Sorry. And then the new antibodies that attack, so they'll attack the spike protein. So suddenly, you're a spike protein, you're like, nah, trust me, this fake ID is real. It's like, no, so the bouncer takes you and kind of throws you away. So that's like the antibodies attacking the spike proteins. And they're training for when the actual spike proteins come. Right, so that same person that's coming, right, suddenly they have a wig the next week. Like, no, I know you, like, no. But they're essentially the same thing. And then, so your new antibodies and the immune cells will then protect you from the illness. So if you were to be exposed to the COVID-19 virus in the future, it remembers how to attack. So again, same ID, I'm seeing it, nope. There's no way, right? Even if you change your hair color, if you decide to put more makeup on, maybe wear higher heels or lifts, you never know. So it's just remembering, it's training, it's like, I know what this is not supposed to be here. I'm going to remember it for next time, so when it is, I'm ready. I know a lot of people are like hesitant about getting vaccines, right? Like not only for COVID-19 vaccines, but like other vaccines in general. When people were asking about my experience, for me, when I got the vaccine, the whole process of like me lining up, I was able to get it earlier than others because, as you might have heard from previous videos, I work in a long-term care, so I am one of the healthcare workers who were able to get it.
Like Canada, and the way that we have our line up to get the vaccine,
It's like a rollout.
Yeah, the way that's like rolled out. First, we have the long-term care workers
and like residents
and like the residents of those long-term care homes, because like they're pretty much the most like susceptible and vulnerable population to COVID. Then as we move down the line, we have more healthcare workers and then less vulnerable populations, I guess that's a way to describe it, then receive the vaccine.
I am the youngest, mind that, like amongst all the people in line. Like I'm not saying they were old, like they were middle age or whatever. So when I'm lining up, they're all like looking at me, of course with my colored hair too. So it is all just like, is she supposed to be here? And I'm like, okay. And so I had gone, waited, they had shot me.
That sounds so violent. It's not. It's not.
No, it was.
Be careful with their wording here.
It's honestly like it was way less painful than the COVID test that I get done every single week. Like if I could get vaccinated every day or like every week, I would rather do that than like getting the COVID test done. Not because the COVID test is painful, but it's just much more discomfort involved. And my eyes always get teary just because I'm not a horse. And then I had to like literally sit down for like 15 minutes. They had to like watch me just to make sure like I didn't have a reaction to it.
It's like when you're in elementary school and you get the vaccines then. Every time, like when you're in school, you get your...
hepatitis ones. And then like if you're a grade 8 girl, I remember for us, our school, it was like the HPV vaccine. I thought the COVID vaccine was like less painful for that than like the HPV thing. But yet again, I was probably 13 or 14 and I am now an adult. Like after that, like I was completely fine. Like the only like I guess you could say side effect or like feeling I had was like pain at like on the arm where they had vaccinated me. Just knowing like COVID vaccines are injected like on the upper part of your arm into the muscle. So there was only pain, but it lasted me like one whole day and that's it. Right? But that's a good thing because it's just showing that there's inflammation at the site, and that means that my immune system is actually reacting to the vaccine, which is an amazing thing because it's showing that this is what is happening and it's doing what it should do.
That brings up another thing. So similar to like when people get the flu shot, some people sometimes say that, oh, anytime I get the flu shot, I feel sick after. It's giving me the flu. No, it's not. It's just your body's response to getting that vaccine.
No, right? Even with like the COVID-19 vaccines, there are cases where, I have the symptoms. The CDC said the COVID-19 vaccine would cause side effects for a few days. That would include fever, chills, headaches, swelling, or tiredness, which are, as they said, are normal signs that your body is building protection for the COVID-19 vaccine. So, like, as the flu shot, if you feel like you have a fever afterwards, it's fine. It's just your body being like, it's working. It's training, right? Like, when you're exercising, you're not, like, you are sweating.
You're sweating, you're feeling a little bit of muscle pain. It's because you're developing that sort of, like, bulk.
And that's why your body, like, you can't see, like, physically you are not doing anything. Like, I mean... like not physically, voluntarily you're not doing anything.
That's better,
but in your your body itself, it's doing stuff.
Your immune system's getting swole. It's bulking up.
So with the two different vaccines, they have two, I don't want to say like waiting times, but like to get the second dose, you have to wait. Like one of them is 21 days, another one is 28 days. I'll go on into like that later. But
can we go back for just a couple of seconds? I want you to restate or like just discuss why there are two vaccines.
Oh yeah. Sorry, I was gonna talk about that. So obviously we know like since the pandemic has started, scientists have like gathered together and everyone's just working.
Literally, we go to an institution. McMaster was one of the first places to isolate the corona, like the actual virus.
Yeah.
Without that work, that literally happens like not too far from where we are right now. Like it's changing the world.
Talking about how like scientists have like been working together. One of like another misconception I could say is that the vaccine was produced so fast, right?
Yeah.
Like how can we trust it? We know that mRNA technology has been studied for more than 10 years.
Yeah.
Right? The technology that like, from the Buddhist monks, it's different. Like
it's not. They're not just giving snake venom and covering it over whatever bite that you got. No.
We have like technology is pretty like evolved since like what was it 1979? You said smallpox was
eradicated. Yeah.
Since then, like we've had it, and also there's the case of that since the pandemic has occurred. Really, all the scientists, all the healthcare like researchers and whatever, everyone like basically put all their focus on the vaccines, right? So that is why Health Canada, specifically again in Canada, was able to get these done so quickly because everyone was focused on this one project. There's also been increased funding, which has allowed for these vaccines to be made so fast and like quickly and like efficiently as they are.
Yeah, not just from like internal like government organizations, like from the government of Canada, but like massive like international organizations, like the World Health Organization, like Bill and Melinda Gates Foundation, like all those awesome places. Like they are funneling and channeling as much money as they possibly can into the development of like these vaccines.
Yeah, and it's like as you were saying before, like how McMaster was like one of the first people to kind of like separate whatever
to like isolate the virus.
Yeah, and the whole thing was scientists were also like able to like quickly figure out the like mapping out the genes of the COVID-19 vaccine, which allowed us to like again the spike proteins played a big part in the vaccine. So once they were able to identify that, like after that, we're just good to go. Sorry, I was out of breath after that.
No, it's okay. It's an exciting, like, it gets you amped up. But really quick, going back to the 21.
The two types steps. So, like, so far as we know,
because it's an important point.
So there's the Moderna one and the Pfizer.
The Pfizer,
The Pfizer one, and I got the Pfizer one. And so the Pfizer one, that one they're both mRNA vaccines, right? And they both trigger a response, but there are like differences. But like at least for me, I don't think there are much like big differences for me to choose one or the other.
Yeah.
But it's up to you to decide if you have like.
If you have, sorry to cut you off there, but it really depends on like if you have certain conditions, certain like allergies, predispositions, certain if you're a certain age group, if you're a certain whatever, that varies. Like which vaccine you get will vary depending on that.
Oh yes. So with the both of them are 2 doses too. You all both for both of them.
In Canada, here are the ones that we're getting.
Yes, everything is pertaining to cancer. So the Moderna one is the effectiveness. We're going to talk about this. They're both over 90%, but to be very exact, Moderna is 94.1% effective, while Pfizer is 95% effective in like the fight against COVID-19 or like protecting you against COVID-19. Moderna, though, however, their clinical trials were only tested on those who are 18 years and older, while Pfizer was on those for 16 years and older. So that tells you that like only if you're 18 year, why can't I say 18 years or older, you can get the Moderna one or you can get the Pfizer one. But if you're 16 and older, you can only get the Pfizer one. It's only like there's no like how do I explain it? It's not because there's like certain reactions if you're younger. It's simply because their clinical trials were based on subjects in those age groups. So they cannot say if it's safe or not for those who are not within those age groups. And sorry. Oh yeah, so as I was saying, Pfizer was 21 days, while Moderna is you have to wait 28 days for the second dose. And the other big one, I would say, is the storage for the vaccines, which I thought was really cool. Like, I knew one of them had to be in colder temperatures than the other.
Yeah.
But for the Moderna one, it can be in like -4 Fahrenheit. I don't know what that is in degrees Celsius.
So
-4 degrees Fahrenheit.
is that like -200?
No, it's higher. It has to be like normal.
Because then that would be close to like absolute zero. Hold on. -4 Fahrenheit to Celsius. Oh, -20.
-20, yeah.
Oh, it's not divided by 32. It's -32. Or multiply.
Anyways,
it doesn't matter, sorry.
And then the Pfizer one is actually much colder. It's -94 degrees Fahrenheit. What is that in
-45.
-94.
90. Oh, that's so cold.
Yeah. Oh, -70. -70 degrees Celsius. So it just shows you that with the Moderna one, it can be, when you take it out, it can be in a refrigerator longer, or like up to 30 days, and it can be in room temperature for up to 12 hours, while the Pfizer one, like once you take it out, you could keep it in the refrigerator for 5 days. That's it.
That points out an interesting thing, though. Like, because these vaccines need to be stored at a specific temperature, that limits certain
distribution plans.
Yeah. Like, for example, if you live in an area that's underdeveloped or doesn't have like the infrastructure to support like freezing these vaccines and keeping them stored and whatever, like you can't get them.
Yeah, that's why I think also like recently there's been a delay in the vaccines, like our second rollout or whatever vaccines. I think I might be very mistaken, but it's like the distribution plans have changed because there's like, of course with storage it's just much more harder to deliver them. I remember before the vaccines had like come out, there was a lot of talk of it being like vaccines won't be able to come out until like September, November for everyone because of the storage of like how will we be able to like distribute them, and if they have to be in so cold, like if they have to be in very cold temperatures, and that was really pertaining to like the Pfizer one.
Sorry, that just reminded me of something. So I remember a study that was put out, I think it was last year. At McMaster, there were a few researchers that were trying to like figure out ways how to store vaccines in different environments. Because, like, for example, if you live in an underdeveloped community and you don't have the capacity to store the vaccine in any way, that's what researchers at Mac were trying to do. And in one specific case, I'm just going to read this article verbatim. It says the new storage or vaccine storage method that the researchers here at McMaster created suspends the active components of a vaccine in a tiny one-dose container filled with a sugar gel combination that dries to seal in the vaccine. Later, clinicians reconstitute the vaccine with water and administer it to patients as they ordinarily would. So rather than like, that's some of the awesome research that's going on right now, where because storing is a huge issue, they're coming up with alternative ways.
That's really good.
This way in particular, you don't have to keep it in a freezer. It's the active component of the vaccine is simply just suspended in this like sugar gel that they reference, and that's how they're like in. For example, going back to the did I say HIV? No, HPV. I think when we were first starting.
Yeah, it was HPV.
I said HPV. Anyway, so with the HPV vaccine in particular, it needs to be stored as well in like certain like temperatures. One of the reasons why it was so hard to like get it to remote communities of in underdeveloped nations like Rwanda or Rwanda in particular, that was one of the things that they had to overcome a lot because there was just nowhere to store the vaccines. So, anyways, now, like, with this sort of technology for countries that don't have the infrastructure or, like, the logistical framework to store these vaccines, they now have new methods, and it's literally enabling people to get that vaccine. It's saving the world.
That's amazing. That's honestly, like, it's amazing. Like, we constantly there are problems being introduced. Like, we have solutions, there's a problem, but science is constantly finding solutions to these problems.
That's what's so cool. That was my little ramble there. I'm not sure if that made sense, but did that make sense?
No, I got it.
Okay.
I hope you guys got it.
The
folks at home.
Yeah. You know what? How funny would that be if this one day got more than 5 views? We're just laughing about it. Anyways.
I'm nervous.
Anyways.
But yeah, so like with vaccines, like what you were saying before, there are like the different temperatures and stuff, and we've gone through like the side effects or whatever. But like there was this article I remember, like just like vaccines in general, of how it would cause autism.
Oh, that's a good point. Great segue as well.
I was gonna say, and I was gonna be like, I know like you did a little search through into it.
Yeah, so going back to the conversation before, earlier in this episode, we were talking about how during the 20th and 19th century in particular, one of the main reasons why people were hesitant towards vaccines was because of their mistrust in science and their mistrust in the people that are like delivering this science. Mm-hmm. That's what it was primarily before.
Yeah.
As we sort of shifted into the 21st century, there was one article in particular which really pushed forward the anti-vax movement. And in particular, it was an article published back in 1998 from Wakefield and a few et al. So a few other collaborators. I'm not gonna name them all.
It's one article too that has caused this much.
One article, yeah. So basically, what was outlined in this specific article was that researchers wanted to see if there was any sort of correlation between the vaccines causing autism. In this article, which was retracted,
meaning it was basically said like this, the information presented in this article is not.
It's not
accurate.
It's not accurate. It's not valid.
Yeah.
That's when this is the whole point of the peer-reviewed process.
Yeah.
When people look into an article, and qualified people look into an article even more, they replicate the studies that were presented to it or in it.
Yeah.
And it seems off. That's when the scientific community says, take this shit out of the way.
Yeah.
Like, it's not helping anybody.
Yeah.
But anyways, but this article in particular, it argued that certain vaccines cause autism. They don't.
They don't.
It was retracted. It was taken back. The individual who, former Dr. Wakefield.
He's not a doctor anymore.
He's not a doctor anymore. They took away his, certification, his, credentials because of the impact this paper had in
on the community, on the whole community, everyone.
Right, the anti-vax movement in general. This one paper has been cited, even though it's been retracted, literally thousands of times. It is now now it's not so much, but when the whole anti-vax movement picked up in the early 21st century, it was bolstered everywhere, and people used it to support their stance on, if I'm not gonna be getting I'm not gonna support vaccines, it's hurting my child, it's gonna give them well, I'm not gonna do an accent, but it's gonna do all that stuff. It's not doing that, and that was a ramble. And
no, sorry, I was gonna say, because I know the article was not instantly retracted.
It was not. It was 2 years after I believe it was retracted.
I was trying to look that up.
Which is why it got so much press, because when it was out and about during that time, people
2 years.
Yeah, 2 years. Which in the whole scheme of things doesn't sound like a lot. No, it is. It's the reason why the anti-vax movement currently is so prominent right now. This one article. And the fact that it's been retracted, but people still, there's been, for every one article citing the fact that vaccines cause autism, there are literally thousands rejecting it and proving otherwise. For the scientific method, like the whole point of science is to question things. So if you're questioning the efficacy of vaccines, to be honest, there's nothing wrong with that. That's how discoveries are made. It's how
questions.
You're asking questions. It's how Einstein thought of the photoelectric effect. He was like, why is light doing this thing?
That's how Einstein talked like?
That's what I'm assuming. The German man spoke like that. But it's literally anything. But yeah, there's nothing wrong with questioning science. It's when you outright deny it without any sort of factual basis, that's what causes a problem with science communication and all that kind of stuff.
Definitely, like, also, like, misinformation definitely plays a big part in, like, how science is communicated. And definitely with the whole, like, I don't want to say that people who are, like, anti-vaxxers are not informed enough, but maybe there's a possibility that they have not done their research properly, right?
Yeah. If I could just add on to that. There's this idea that we've spoken about, I believe in a previous video called the common motive. Oftentimes people act a certain way because they want to do it out of like the good of, like, they want to do it for good. So if you look at the concept of like vaccines, for example, parents who choose not to vaccinate their children are often doing it. There's some people that are a little out there, but oftentimes in conversations that doctors have, the reason why people are choosing not to get vaccinated or vaccinating their children is because they don't want to harm their children. The fear, like, that very understanding that, like, people are doing it because they think it's for the good of others. That's noble, but they're doing it from a stance, like an uneducated stance. Right? That's where the issue rises.
I was gonna say though, like, I'm very curious because, like, I had an experience, but individuals that who do not vaccinate their children, how are they allowed to go to school? Because I remember in elementary school or something, there's like a time, there's like one of the vaccines I had to take like every couple of years. But there was like, I don't want to say a handful, but there was a couple of us like in my class, including me, who had not gotten it. My parents completely forgot about it.
No, it's me too. I know what you mean.
So my brothers were like 5-6 years older. So like with me, it was like, oh yeah, forgot, like whatever. So
that kid, right? They need it.
So at the time, we had gotten like the notes were delivered to like the students who didn't get the vaccine, and it was basically saying if you don't get the vaccine, you can't come to school. Right? So I'm curious on how like parents who choose not to vaccinate their children, how are they able to go to schools? Like, I'm assuming maybe like in other, like maybe in our neighbor, like the US, there's different kind of laws, but like in Canada, I'm curious on how that would like go about. Like, how are they able to get education?
That's a good question. For most vaccines, from my understanding right now, there's no like specific mandate requiring students to get them. It's up to choice.
But I still remember them like, you can't come back to school until you get it or something. So
that brings up a good question. It's how they navigate that is interesting.
It is interesting. So just, because it definitely also like the idea that there is a risk that your child could get sick, right? And I remember reading something on how these parents decided to go they decided not to vaccinate their child, and the child didn't find out until like years later when they got measles or something. And they were just like, wait, what? Like they believed they were vaccinated the whole time. So there's also that.
Just to add on to that, like, I remember reading an article from the BBC. I think this came out like a couple years ago. This kid's parents were like strongly anti-vax. The kid was not. So, like, the kid wanted to be vaccinated. And I think this kid at the time was 16. And they had to go through this like entire legal process in order to get permission to be vaccinated, because their parents, like, when you're
was it like an individual in Canada?
No, I think this was in the UK.
Okay.
This was a BBC article. I'm pretty sure it was from the UK then.
Okay.
But yeah, the legal process, because when you're under a certain age, depending on which country you're from, you're not considered autonomous, meaning like you don't have like control. Because like you can't, like, you're too young to act sound
decisions.
mind. Yeah, to make like huge life-saving decisions.
Getting vaccinated is a huge
decision.
But
in stuff like that, like I don't think anyone should be like held back from doing it. Like if it's the kid, like you're almost an adult. Like regardless, like the person's not making a decision that's harming themselves.
I think we also, like, to be honest, we're kind of biased, right? In this case,
yeah.
right? Because we are for vaccines.
Yeah.
Right? We believe in the science behind vaccines. But let's say this individual is, like, they haven't informed themselves that much. Or, like, it can't even be about vaccines. It could be about something else.
Yeah.
Right? Like a surgery that they want to have done. Or, like, stuff like that. Where, like, you know, you're at an age that maybe, like, you're not old enough. Or, like, you're not... aware of like all the pros and cons behind it, but you just know what you want and you want to do it, right? So of course there is an age limit for that, but yet again there's also like exceptions, like how about vaccines, stuff that could, like, you know, things that you might need, and it's very hard to make policies probably like, to specific things. So I also think like maybe in that case, just to be like devil's advocate.
That's very valid. Thank you for mentioning that side of the argument. But yeah, if the individual has a capacity to like absorb information and base their decision from like, or provide informed consent to you know, receiving vaccines, I don't think they should be hindered from doing that.
No, if there's like a way to get like, if a child wants to get vaccinated, right? If they kind of, they're like 12, 13, 14, however old, right? And they're like, I want to get vaccinated, but their parents don't want them to get vaccinated. It's not fair for them to wait until they're like not a minor to get vaccinated when there's so many years in between that they could be not only compromising themselves but compromising other individuals.
Sorry, I lost my train of thought.
No, it's fine.
But yeah, it's interesting how like the next few years, I guess, of health policy are going to change that, like especially with the COVID vaccine. Is it going to become something that is mandatory and enforced, or is it going to be up to choice and decision?
It is. Even like the COVID vaccine that I got at my workplace, it was not mandatory. I should mention that. Individuals were given the choice of if they wanted to get vaccinated or not. So all like the healthcare workers at my place, majority is what I've gathered from, have chosen to get the vaccine. For the residents, right? So they have their what's that word? The people that make decisions for them. Beneficiary? Is that what? No.
Beneficiaries? No, that's let me look it up. I know what you mean. Like
power of attorney kind of thing?
That's it. Yeah.
So like they have those individuals who choose if they want to get like, if the residents, because the residents that I encounter with every single day are not in the mental like capacity to make decisions like that. So I know again, majority, we even had the residents like a week or two ago got like their first dose of vaccines. So sorry. I just want finish your thought.
No,
I was just gonna say, I think like the COVID-19 vaccine is not something that's gonna be mandatory, but I believe that like there might be restrictions for individuals who choose not to get it. Just because like, at least for like the first year or two, just to get things back to like normal, I guess, to an extent. So I'm very curious, because I'm like, you know, I have like the COVID vaccine. Does that mean like once everyone gets the vaccine, do we still wear masks? Or are there still going to be like limits or whatever? Like, of course we're going to have to wait until cases go like basically next to nothing before things go back. So I'm still like curious on how that will work.
In your workplace, you were saying that like the power of attorney, if the person's not like of sound mind to make that decision to get the vaccine, they don't make it. They have their whatever make it for them. What if the person, going back to the conversation you had before, what if the person isn't of sound mind?
They are?
They are not.
Oh, are not,
They want the vaccine, but then their power of attorney says no.
Well, here's the thing, like, I don't want to make residents seem like they have no, like, mental, but, like, when there is a very good assessment done by psychologists or, like, there's a social specific, there's a standardized test. So when that is done, right, it is, I believe, it's, like, a pretty accurate evaluation of their mental capacity.
Capabilities
and capacities.
Ability.
Ability. that's done, like if they have a power of attorney, it is really because they are not able to make the thing. So it's not even them going to be like, I want it, why can I not, right? But yet again, it's
or even like, sorry to cut.
No.
But yeah, finish your.
No, go ahead.
But I was gonna say.
Done.
Yes, I was just gonna say, like, even outside of your workplace and in the old folks' home that you work at, like, what about in that situation, like that, like.
Oh, power of attorney kind of thing.
Yeah.
Again, like.
I know it's. Sorry, I cut you off again. Damn.
No. I was gonna say. Sorry, I was thinking. I was kind of processing. I was gonna be like, I was thinking like, the person chooses their power of attorney. Right, so one would
not always though.
Really?
Not always.
Okay, majority of the time. I might be. I don't have a power of attorney.
Think of the case of not Whitney Spears. Britney Spears.
Oh,
she didn't choose her dad.
That's true. Okay.
It's not always.
Okay, that's a very. I really like what you brought up.
Yeah, because like this is those gray areas of health law and health ethics that need to be addressed, not just with the COVID vaccine, but vaccines in general.
Like the intent is like they're placed with the intention of like making sure no harm is done on these individuals, right? But I guess for the cases where people do choose their power of attorney, that they choose individuals that they can trust in making
that represent their ideals and all that stuff.
Yeah, but in cases like Britney Spears, well,
is Britney getting that vaccine?
Jamie Lynn Spears, though, now is her power of attorney, I believe.
No, it's still the dad.
What? I saw an article, like...
Is this fake? Is this
fake news? So I saw this guy's on Daily Mail.
I don't know, it's a conversation for a different thing. We'll look into it after.
Yeah.
But, yeah.
That's very interesting. I feel like, yeah, again, like, health policy and stuff like that. Definitely. I don't know what else more they can do.
Oh, I'm sure they got something up their sleeve.
I really hope so.
We're screwed.
I really hope so.
All those people with power of attorneys.
Yeah.
And whatever. Or even kids. Like, not even, well, I mean, like...
Emancipation.
Yeah.
That's if you want to get a vaccine, get emancipated from your parents. No, sorry, I take that back. Please do not take me seriously. Sonia's like, hey, do it.
No. But... Put that out there.
No.
But, yeah, Jaanuni, I think that wraps up a very fun little conversation that we had.
I really enjoyed that.
Yeah, and I hope you enjoyed as well.
Get vaccinated.
Yeah, not just the COVID vaccine when it eventually comes out, but just vaccines in general.
Yeah.
If you have questions, ask your qualified healthcare provider.
Or even, sorry to interrupt, but the Government of Canada website is very well informed.
Yeah.
Breaks down like the science into the very like removes jargon as much as they could.
Yeah.
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 Also, we'll post some links below for resources that are relevant to the situation. And
inform yourself.
Yeah. Yeah, because as much as we are spewing information at you, we could be very wrong.
Science could change, like in a month, or who knows?
Yeah, who knows? But anyways, thanks for joining us here today on another episode of Beaker Bros. Bye.